the drugs, so I'm going to let you know what you can actually get or what you can expect to get when you go to the pharmacy. First off, what is a formulary? Most of you probably never heard that word before tonight. That's actually the listing of drugs that we cover. And what we cover is approximately 160 medications and medical supplies that you would be eligible to get whenever you go to any public or private pharmacies that are on the planet. With each drug, there is a maximum amount that's assigned that you can get per month. And for the most part, this goes hand in hand with what you would be prescribed. So you're not going to be able to get extra drugs, but you should be able to get enough drugs to last you through that month. And then you'll have to go to the pharmacy on a monthly basis to get the medications refilled. Now, if you're going on a trip or you live on a family island, you can contact us to get approval to have up to a 3-month supply in special situations. So we do allow for those allowances. We do have some drugs that can only be prescribed by specific doctors. Example is a patient that has breast cancer. You can only be seen by an oncologist or a specialist in cancer to get that medication prescribed. So, you know, maybe you see Dr. Menace, but he can't even write for you to get breast cancer drugs. You have to see a cancer specialist. The list of drugs that we have will be reviewed and amended over time. So if your drug isn't on the list today, that's not to say that in 6 months it won't be on the list, because we are going to be reviewing this list and adding other drugs as necessary. The drugs are available to both public and private patients. It doesn't matter if you see a public doctor and then go to a private pharmacy, or if you see a private doctor and then go to the public pharmacy. It'll be honored as long as it's a valid prescriber going to one of the participating pharmacies. What we have done is we have made a formulary booklet like this for the physician. This lists all the drugs that we have. It lists all the how to dose it, what the side effects are. Any information that your doctor would need to know about prescribing the drug is in this book, and this has been made available to all physicians. It's also available on our website, so if you want to go and find out more information about the drugs that you're on, you can go to our website, which is nivdrugplan.com. Pull up the formulary, and you can find out additional information and what information that we've actually provided to the physician. Some of the questions that we get a lot are, do you cover brand name drugs? We hear this plan is just all generic and you just only cover the cheap drugs. That's not the case. We have a mixture of both brand name and generic drugs. And we have to have a mixture. In order to be able to afford to provide all the medications that everyone needs, we need to have some generics in there to help to balance out the expensive brand name drugs. For example, for prostate cancer, we have a drug that is over $600 that people can go to any pharmacy and get free of charge if they have prostate cancer. So we do cover the expensive drugs. But to balance that out, we also have some of the generic products that don't cost as much. So the next question you might ask is, do these generic drugs work? And the answer is yes. The generic drugs that we have on our listing are generic drugs that are used very commonly, very frequently throughout other countries in the region. They have been tested by other countries in the region to show that they do indeed work. And all the manufacturers that produce these medications have been approved either by the FDA in the United States or by the World Health Organization. So we are using reputable companies to get our generic products from. Additionally, if anyone were to have a problem with the generic medication or any medication, be it brand or generic, because you can have problems with brand name products as well, if you let your physician or your pharmacist know, they have an adverse reaction form or just an adverse drug form that they can write to us, let us know what the problems are, so that whenever we review our listing, we would know, okay, we need to select a different product because that one is causing problems. So it is important that if you're taking one of the medications and it doesn't work as well, make sure that your doctor knows that he can evaluate that and he can let us know. So let's look at our diseases that we cover and what medications. As we mentioned, we don't cover every drug. So what we do cover are drugs from the major classes of drugs that you would need for treatment of your disease. So there are plenty of drugs to treat any condition that you may have. So for arthritis, we have drugs from our NSAID class. We have a lot of different choices. We have ibuprofen, meloxicam, the brand name of that is Mobic, diclofenac, naproxen, and we even have Celebrex on the plan. We have drugs that not only for just plain arthritis, but also rheumatoid arthritis. So if someone has rheumatoid arthritis, we have hydroxychloroquine and methotrexate for that. Under arthritis, we also cover gout, which we have allopurinol and colchicine. And then we have other drugs that may be needed to help with the treatment of arthritis. So acetaminophen or Tylenol. We have omeprazole, which is for your stomach, because a lot of times these drugs for arthritis can be hard on your stomach. So we want to make sure that we help to treat that side effect, so we have the omeprazole available. And then we have prednisone. If you're having a really bad flare-up, your doctor may need you to take some prednisone to help cut that flare. The next condition is asthma. For asthma, we have a variety of products. We have our beta-2 agonist. We have the Ventolin inhaler. We also have Ventolin in tablets and in suspension. So no matter what form your doctor is prescribing the Ventolin in, we have it available. We also have the nebulizer available. So for patients who have really bad asthma and have to do nebulizers at home, we have that product available. We have the steroids. We have our fluticasone, which is an inhaler, and then we have the prednisone as well. And then other drugs that we have the Singulair, which is a tablet that some people take, and then we have the Vanair, which is another inhaler that's a combination of the beta-2 agonist and the steroid. So we have that product available as well. Now with asthma, we know that sometimes just the drugs aren't enough. So we have some supplies to help assist with the management of the asthma. We have the nebulizer, so if someone does have severe asthma and needs the actual nebulizer machine, we have that available. We also have spacers. And spacers are used to help people who have asthma and maybe can't hold, can't breathe in the whole puff at one time. And what you would do is you would put your inhaler in here, put this over your mouth, press the inhaler, and then breathe in. And it makes sure that you get all of your medication, so you're not wasting any in the air. Because a lot of times people feel like, I'm not getting it all the way into my lungs. So this can help. And your doctor just needs to write this on a prescription, and these are free of charge as well. And then we have peak flow meters. Now these are really good for children with asthma. And what these do is the child would breathe into this. The doctor would help you set, like when you're in the green zone, which means that your asthma is really well controlled. When you're in the yellow zone, which means that you might want to take it easy for a little while. And when you're in the red zone. And when you're in the red zone, that means you're having an attack and you need to take your medication, sit back. But a lot of times children will use this before they go to PE. And that way it would let them know if they need to use their inhaler before they go into PE or if they just need to set out that day. And again, all of our supplies are free of charge. And we are going to be doing training programs to help, we're going to be going into the schools to teach children with asthma how to use these products and how to manage their asthma better. As we mentioned, we cover cancers. We have breast cancer and prostate cancer, which are covered on our list. For breast cancer, we have the product Arimidex and Tamoxifen. And for prostate cancer, we have bicalutamide, Zoladex, and then ketoconazole and hydrocortisone, which are taken in combination a lot of times. Now, one thing, we've had a lot of men coming in wanting other drugs for their prostate, the Flomax and those things. We're not covering those right now, but we are looking at adding those. Those aren't particularly for prostate cancer. They're more for benign prostate hypertrophy, but we are looking at hopefully adding that in the near future. We covered